So MedTech Europe is regrouping 45 multinational and as well SME company in Europe, based outside as well Europe, but having a footprint in Europe, and 50 medical trade association, national medical trade association. So our goal is to ensure that patients have access to innovation in Europe and to medical device and IVD in vitro diagnostic as well. So just would like to do a quick comparison of the situation with the US, because we used to have in Europe innovation at the same time as in the US. And what is the reason why now there is a lead time or a significant delay in having new device and even legacy device, because we had to go through this MDR journey between the US and EU. So for orthopedic device, for spinal device, in the US, you don't need to perform, you can go to 510K for the non-critical or non-high risk device. It does mean that you don't have to collect clinical evidence. You can perform bench-top testing, meaning that obviously the delay in order to collect data is less longer. And we have the PMA pathway for high-risk device. Now, moving to the EU, we used to have the MDD, as you mentioned, Medical Device Directive, which was a directive, meaning that there was some leeway for interpretation, and through the different member states and through notified body, we saw a lot of different interpretation in the past. That's the reason why regulator decided to move from MDD, so a directive, to a regulation. And since 2021, we have a medical device regulation in place. So why? First, in order to strengthen patient safety, that's what you mentioned. To build trust in the European CE marking system because of the recent history that we had and scandal that we have. The decision was to upgrade the Medical Device Directive to move to the regulation and to modernize as well how Europe regulate medical technology. What does it mean? Greater emphasis on clinical evidence, improve transparency, and reinforce post-market data. So what about spine implants? We've went through an up classification on some of our products. Interbody device has been upgraded from class 2B to class 3, vertebral body, and as well bone substitute, which mean more data, but as well more report to be provided. The summary of significant clinical performance for healthcare professional and for patients, patient card and patient leaflet for class 3 device, when plate and screw and pedicle screw remain as class 2B device. What about clinical evidence? The situation with MDR is that we have challenged to use equivalence. It does mean that we have to demonstrate on the one device, if we want to use equivalence, that we have equivalence on the technical aspect, the biological aspect, and on the clinical aspect. It does mean that this route that used to be used in the past is very challenging to be used nowadays. It does mean that we have to generate specific clinical evidence for a product, for legacy device, as well as for new innovation and new device, which explain partially the lead time that we can see compared to other jurisdictions. EU MDR really increased this obligation. What is the situation today? We saw a significant increase of the timeline and the cost from the notified body. keeping in mind that the grandfathering approach that we can get through different jurisdictions has not been accepted by the EU Commission. So all products had to go through this upgrading obligation. Some legacy devices disappear from the market for many reasons. First, because of product rationalization, because of the cost, but as well because some manufacturer, an SME manufacturer, decided to deprioritize or to be removed from the EU market. And we can observe, you might have observed some product disappearing from the market. There is significant burden as well to maintain compliance over time with MDR in generating safety and clinical performance, in generating post-market surveillance data, and because of the recertification that is happen every 5 years. And innovation, I'm not going to say that innovation is leaving Europe, but we can observe 4 years delay between the US and EU. And you know, this is not because manufacturers don't want to launch product in the EU. It's really because we need much more time in order to collect data. So you might, through your visit in the US, see innovation that patients in Europe are not going to benefit nowadays, which is a challenge. However, I'm going to end on a positive note. We are expecting, through our effort in terms of advocacy with the EU Commission, to see some improvement. I think that we were in a learning curve, and the EU Commission and the member states start to realize that innovation is leaving Europe, and that some products are not available anymore in Europe. So we are working actively in order with regulators in order to improve the situation. But it takes a little bit of time. Thank you.
Thank you, Michel. To be honest, doesn't sound like a rose garden for your business.
That's a challenge, but we need to go through.
Nicely put.
We don't have any choice.
You need to be positive, huh?
Yes.
Thank you very much for your presentation. We will discuss a bit later.